All right, I am Sandra Ajao, and welcome to the Sajpointe NCLEX virtual class. I will be taking you through how the program would run. I'll also take you through how to create your portal, create your account on the student portal, and also how to use the HESIS on this. I'll try to be very brief so we don't have like a very lengthy orientation video to go through. Okay, so here's the content of what we are going to talk about. And here's our mission in Sajpointe Health, our vision, and our objectives. Okay. So you should also know that aside the academic part of Sajpointe, where we run the NCLEX review programs, we also help with the NCLEX complete registration package, where we guide you from start to finish um, for your licensure process. We help handle your credential evaluation, board of nursing registration, criminal background checks, all till when you take the test, pass it, and then we move you on to pre-arrival group where we help you go through the immigration phase, put you through with reputable agencies and immigration stuff and all that. We don't need that now. But just know that we guide you from the very beginning to the very end of when you achieve that American dream, when you deploy to the USA to work as a nurse. So if you need any information on how to get on the NCLEX complete registration package, please contact this phone number here. Okay. So now about the program, we have four main classes. We have the beginners class one, beginners class two, mastery class, and the about to test class. The beginners classes are just for the content. It's the content review for Search Points, and we recommend 2 months for this class. And that 2 months you should have covered the basic the 9 modules on the HESI. We utilize the HESI because it's straight to the point and it's really it's concise. So beginners class one, if you're just starting to prepare for the NCLEX, you start with this class. If you're trying to improve your maybe scores and question bank, you can also come to this class because sometimes it's just lying there in your foundation. Maybe you don't have the right content, so you can come to this class to help brush that up. And we also do this in the beginners class too, which is a continuation of the content for beginners class one. So after all this, you move on to the mastery class where we deal a lot on prioritization questions and delegation questions. And also there we ambush you with like so many in-class questions. We're feeding you like with 50 questions per day, 25 in the morning, 25 in the evening till for the entire program. So at the end of the batch, you've at least answered over like 1,050 questions. Because the more questions you answer or sample questions you answer for the NCLEX, the better your chance in passing the exam. So after that, you move to the basic class where we recommend like at least 3 months in that class, nothing less than that. Okay. So that's the about to test class, and we go over those topics again and again till it's like a full part of you. It moves from your temporary or your it moves down from your just your temporary memory, as I'd say, to the very permanent one, where if you're sleeping, you wake up and you ask you a question and you can just say it out, from your subconscious. It's just we want to get you to that level where, this information, this knowledge is well grounded in you. Okay, so these are the four classes. And in total, if you do as you're supposed to do, if you're serious, you take the program seriously, in 6 months, you should be done, take the test, and you pass in your very first or next attempt. Okay. All right. So we utilize the HESI standards, as I said, because it's very straight to the point, it's concise, and yes. It has 9 modules, which we've divided into two, one for the beginners class one and another for the beginners class two. And for this beginners class one, this is what we're going to be covering: adult health, child health, critical care, and all that. And the EKG is a bonus class for you. Okay. We'll talk about how we're going to be doing the EKG class and also the pharmacology, which is also like a bonus. So now to be promoted to the next class, you have to have 60% overall and have attempted all the tests for that class batch. Okay. If you have 60% and one test was not attempted, that's like a fail for us. Okay. That is because each of these tests questions represent a particular content area for that class. So if you're missing out on one test, it simply means you're deficient of that particular content. So to move you on to the next class, we recommend that you completely finish all your tests and at least have 60% is your cumulative score. If you don't have this, we would not have you to the next class. But then again, that's our recommendation. That's what we telling you. This is what we advise, but it's always 100% up to you to decide to move on or go with what we are recommending. So another thing students tend to do is to pile up their tests. Ensure you're not doing this. I understand we have responsibilities. We have job responsibilities, family responsibilities, and church responsibilities. All of things as adults. Just ensure that you're not piling up this test so much, because the more you have them piled up, the more the chance of you not finishing up, and you discover you're taking the beginners class one multiple times over and over again, and you're not things as adults. Just ensure that you're not piling up this test so much, because the more you have them piled up, the more the chance of you not finishing up, and you discover you're taking the beginners class one multiple times over and over again, and you're not moving on. Okay, so try as much as possible to at least, every 3 days cover up your test. Don't make it more than three at a time, because it becomes too overwhelming for you to finish up. Because at the end of the um batch, we're going to shut down the portal and release your results to your email. So please don't pile up your test. Try as much as possible to at least attempt your, test three at a time, and not like five or six, because trust me, it's just going to be too much. Okay. So now, the Sajpointe student portal, this is just like a brief um slide to show like what the content each of the functions we have there. We have the NCLEX bank, where for continuous assessment through your stay in Sajpointe, live class notes where you have class notes uploaded, or lecture notes uploaded after the day, NCLEX videos after your video lectures. You have your video links uploaded there for you to use, okay, for you to go back to and revise. NCLEX library has all the resources you can think about, and also your NCLEX key points. We've put together mnemonics, lab values, key points for each disorders there. You just download the PDF and you have it handy in your device. Okay, we're trying to make learning the easiest and most inspiring for you. So now the virtual class program, you're entitled to 6 lectures, no more than six. Okay, so 3 video lectures, which is going to be Tuesdays, Wednesdays, and Sunday, and also 3 WhatsApp lectures, which bonuses. You can join, you might not join, but I recommend you join, because students go through this and they pass, and they really learn a lot. So the WhatsApp classes are Fridays and Saturdays. Pharmacology for Friday, in EKG on Saturday, and you have like an extra noon lecture midday on Saturday. So that makes it a total of 6. So now, the classes you belong to, you're gonna be joining 4 classes. The admission specialist must have sent you a link to 4 classes. Ensure you join all of them. Don't join one and leave the others. You have to you have to join every of those classes. The virtual class, Farm Noon, Sajpointe EKG, and the Sajpointe General class, where you're going to be having student success stories, class adverts, and things like that, and generate information about the NCLEX. So now these are course extras, okay? These are the extra things we do for you to learn, okay? So this a day, one of it is daily NCLEX feeds. One thing you're gonna be seeing as you start is we're gonna have one of the admins like post key points every 2 hours in the group, and it's simply like for the first every if you check a timetable, you see, okay, we have listed out this topic for you to study, and it has on this and where to find it. So that topic, we go through it and get out this very key information we need you to know. Because trust me, there's a whole lot of things to learn. So you're looking at maybe like 42 pages of what you have to learn for that day. What Sajpointe does is bring out or to bring out like very key things we expect you to take note of, to really know, okay, for that 42 slides. Not that it's all what we want you to know. We're just like trying to bring out this one so you can have it like registered even more. All that, 42 slides that you have to study for that day. So also what we're trying to achieve here is for you to study on the go. Okay, you don't have to be seated on a chair in front of your laptop, or to study. You can be studying while you're cooking in the kitchen, while you're maybe at work, expecting to see a patient, or even while you're even watching TV, or just chatting with your friend on your WhatsApp, and those things just come up and you read through them and okay, I just learned something now. So we want to help you achieve that learning on the go. You don't have to, be all serious and, at the point, like I'm gonna study from 2 p.m. to 5 p.m. to read. You can just study at any time. I mean, you achieve more that way. So at Sajpointe is simply us telling you you can ask us any questions as you study for the day. Okay, just come into the group, the virtual class group, type in your question, put the hashtag Ask Sajpointe. We're gonna have one of the instructors or the admins come in here there to answer your question. Okay, and we also award best students. We give scholarships, and this is to motivate everybody to do the very best. Okay, so these are the extras we do, the extra length we go to help you learn even better. So this is the Hesse Saunders link. Okay, I will be taking you on how to use the Hesse Saunders on my next video. This is the link, this is the username, and this is the password. All right, so tech admin contact here. It's here. Please make use of this. And yeah, thank you for listening and welcome to Sajpointe Health. Once again, I am Ajao Sandra. I'll be taking you through how to navigate the student portal. The portal is very user friendly, and you don't have to be tech savvy to navigate it and use every resources or content it has. As you can see, I'm enrolled in 4 classes. For you, it's not going to appear this way. It's going to appear as one class because that's the class that you enrolled for. And in this case, the NCLEX Beginners Class Virtual. So this is just what you would see on your portal. On the left side, you'll see different subsections of the portal. I'm not going to go over them. It's simply, it's very explanatory. You can click on that to see what it has. So to access the student portal fully, you click on this class and it takes you right here where you can access the class resources. You can see Sajpointe brochure. You can download the brochure of the academy here. Class orientation. You can download the video here. Okay. You watch it directly. You have the class timetable. You can view the timetable here. This is very important because you have to go to the timetable every day, even if we're going to update you in class what the topic is written for that day. You can also access this in your timetable. Like for instance, the first topic, which will be tomorrow, Monday, would be safety and infection control. You go there and that guides you on what to study on the HESIS on there where we access the content for the NCLEX. And also, if you go to class notes, you can simply just download the NCLEX feeds for that day directly to, or for that topic directly to your device, okay? All this have already been, we have all the class notes, all the content for the class uploaded already on the portal. So you have access to all of them at the same time, but don't overwhelm yourself. Go according to what you have for the day. Go with the timetable. Okay, there's a lot of time. This class would run for 2 months, so you have a lot of time to finish everything. So you access your family and class notes here, EKG class note here. We just have one. There's always going to be one for you to do, for you to access EKG fully. We don't upload notes, class notes, lecture notes for EKG. You have to be live in class or you read that up straight up from WhatsApp. NCLEX key points. This has NCLEX key mnemonics. It has lab values, things you need to have in your fingertips as an NCLEX student. NCLEX library, every kind of resource you can think about for the NCLEX, you have it here. Audio lectures here. You can access every topic if you the kind of like to listen. Maybe while you're doing chores, while you're driving, just listen to something and learn, you do things or get activities done. You can have access to all that here, more textbooks. If you click on all, you can access every single one of them. Okay. To review library also, this is more resource for you. Okay. You can access them here. Audiovisual lectures notice board where we have the dates for next classes and how to register. So now the most important part here is this here where you get to take your test. Okay. So if you want to take your test for the day, okay, for instance, the topic, as I mentioned, it's Monday and safety and infection control. You click here, you can see we have different topics that you need to cover for the entirety of this batch, which will last for 2 months. So we have safety and infection control here, you simply click on that and it will take you to the test. Okay, you do it, you attempt it, and you submit. Okay, you already have one attempt with it. And you can see some of the red check marks. All this one simply means that I have done this test before. The good thing about this is that sometimes you can decide to do multiple tests at the same time to complete your lesson. Maybe you're off for that day, you don't go to work, you can decide to stay at home and maybe just do 5 tests, read up um, the content for them. Ensure you read up the content before you attempt the test. To get out of here, simply click on the back button. And when you do that, it takes you back to the class resources. And if you want to access your progress, again, you go to dashboard. Here you go. You can see this is NCLEX. Check your completed lessons here. My test attempt here. It gives you, shows you every test that you've attempted so far, and also how to your scores and your score breakdown, and it gives you details of the question and the rationale, which is why I'm bringing this in. This is very important, okay? So to access the rationale, which is very important for your NCLEX preparation, you want to study your rationale, see why you feel the question, and learn the content for that particular topic. You click on details, and this is for infant, child, and adolescent. So you can see how it appears, and these are all the tests that you attempted. Okay, this is the topic. This is the question one. This is the question. This is the answer given, and this is actually the correct answer. So, incorrect. To access the rationale for this, why you failed it, you simply click on this drop down here. This is very important. Please don't miss this. Sometimes you might fail to see the rationale. You're asking, you're looking for it. It's simply here at this drop down. It's very important. You know this, okay? You click on the drop down here, and you see it gives you an explanation, it gives you the rationale for why the answer is what it is. Okay, same here, same thing here. Click on the drop down, please. To access the rationale, click on the drop down. All right, so you can always go back to previous tests that you've done. Click on my test attempt. It takes you back to all of your tests. Okay, you see different topics of the ones you've done before, emergency response plans, any one you want. You go to details and you can access the rationale, because that is how you learn. You have to study the rationale, know why you feel the question, and what you can learn from it. Okay, so if you have any questions, please reach out to the tech admin. He would be there to guide you and answer any questions that you might have. Thank you.